Now, let's move on to the chapter 4 of our episode, how to spend less while navigating the US healthcare system. So far, we have talked about three different chapters. Number one, I shared my personal experiences navigating the US healthcare system, how I was surprised by 10 facts. And based on those 10 facts, I talked about five fundamental truths for chronic constipation patients. And obviously, we visit our doctor a lot. Hence, we need to optimize our doctor's visit. I talked about how to optimize and make the most out of our doctor's visit every time. Now, it's time to talk about saving money. We visit doctor a lot of time. We spend a lot on tests. We spend a lot on medicines. We spend a lot on treatment plans and so on. But there are a lot of ways that we can take control despite the structural incentives the US healthcare system has. We can do something about it. So I have 20 different items in it. I have categorized into sections such as general strategies, mitigation insurance strategies, and so on. So let's dive deeper. And one more thing which I'm going to add on is the 21st one, which is gonna save a ton of money. Please watch till the end. Out of those 20 ways to save money, six of them are general categories. Here are those six. Number one, maximize in network care. Number two, prioritize preventative care. Number three, opt for generic medications. Number four, understand your insurance coverage. Five, use telehealth options. And number six, check for billing errors. Let's start with number one, maximize in network care. We have talked about this. We can choose our providers who are in network and out of network. In network, the insurance companies would have negotiated for the rates, the discounts, and so on. Whereas out of network, that is not done yet. Therefore, there may be a surprise bill, and also the cost is a bit of higher. As explained earlier as well, sometimes this out of network is not in your control. What that means is you go to a doctor and they perform some test and send that particular lab can be out of network, which doesn't allow you to choose which lab it goes for testing. And obviously, we can be proactive on that part. And whenever we talk with provider, while for tests and labs, we can actually have discussion with them. Is it with network or out of network? And we can ask them to send only to their in-network, our in-network uh, testing services. That can save a lot of money. Number two is prioritizing preventative care. So prevention is not only about getting a preventive care from our providers, but also about taking care of ourselves, preventing the diet, preventing the lifestyle that triggers our symptoms, and there are home remedies that we can do in that can prevent from our A, getting our disease worse, B, also while doing the pain management, it can help us get the relief faster. But when we go to preventive care, I talked to you about our 10 surprising facts that we may get a surprise bills because we don't know what is covered and what is not covered. But at least what I do is I go for preventive care. I get the basic panel work done, blood work done. The doctor asks for generic questions. At least like those general things are taken care of so that any symptoms I have, any problem that I have doesn't exasperate. And when we utilize the preventive care better, we save money on urgent care or emergency room care because we don't have to go there. I think that's the best way of saving money. So prioritize preventive care, not only on the from the providers, but also by yourself. And number three is opt for generic medications. I'm surprised that there, well, I shouldn't say I'm surprised, but there are brand name medications and there are generic medications which do the exact same thing. And if you're curious about it, when you visit the pharmacy next time, you don't have to go for any very specialty uh, drugs. Go for very simple drugs as well and check the prices. And in the same area, you'll find a brand name drug and a generic drug. And if you take those out, read the ingredients, even for the over-the-counter ones, it's exactly the same thing. The price may be 50% cheaper for the generic medications. And even for the specialty ones, they may be tenfold, 20-fold cheaper. Obviously, we are not doctors. We can prescribe the medication for ourselves. But what I mean is, if you're buying over-the-counter drugs, we can choose for generic medications. And also, when any prescriptions our doctors prescribe us, we can at least ask whether there are generic options which may do the same thing. For example, when I had a hemorrhoids and I had a consultation with my gastroenterologist, I was prescribed a special ointment that cost $60, whereas the generic version, the over-the-counter version, cost $12. And is that specialized ointment, which cost 5 times more, is 5 times better? I believe is unlikely. At that point in time, I wasn't aware of this. Now, as I'm aware, I definitely have conversations about, okay, how much better that is, whether the cost worth the reward or benefit that I would get. So by just being conscious about opting for generic medications, we can save a lot of money. Let's move on to number 4, understanding insurance coverage. Obviously, most of us, when you purchase our insurance annually for open enrollment, what we do is we choose for different plans. And sometimes it's so confusing. We will choose the most expensive one. So for example, PPO one with the high premiums and think, okay, let's just get it because I'm going to visit doctor so often. But that may not be necessary. We can for high deductible plans, and if you're taking care of ourselves, then we don't have to visit doctor so often, labs so often. We can save on that as well. And also for medication tests and treatment plans, we can definitely go and check what's covered and not covered. And if you're going to get tested, and then we can get pre-approval process. So again, we can save a ton of money. So we kind of have to be, unfortunately, we have not not PhD in coverage, test coverage, but at least has some high school or college level interest in understanding our insurance plan. And number 5 is use telehealth options. For chronic diseases, for example, IBS, there may be more frequent doctor visits because visits. And if you want to travel to the doctor's place every visit, you need a car, parking, your time, and if you can do on telehealth options, you can actually save on those ancillary costs. Again, it's a trade-off between whether in-person visits are better or telehealth visits are better. In-person visits may be better if you have to get a physical examination done. For that, there is no other option but to go visit for in-person doctor's visit. But whereas it's a follow-up calls, we're discussing about symptoms, there is no physical check is required in that option. If you do telehealth options, you can save on all the ancillary costs such as travel, saving time, parking, and so on. And we may not think about that in terms of the cost, but because of the number of frequencies, it can certainly add up. Hence, opting for telehealth options can reduce those costs. And number 6 is checking for billing errors. You won't imagine how often the billing mistakes can happen, intentionally or unintentionally. And also think what can happen is there's something called upbilling. There are actually companies that sell services to the healthcare systems that help in maximizing the revenue. And one of the techniques is upbilling. Therefore, whenever we get the bills, we have to check for the bills one by one. We also get explanation of benefits, and we get the bills. We need to match that and say, okay, we're actually paying for the treatment or the care that we are getting. Sometimes it can be upbilled. And if there is any confusion, we have to just call and ask and haggle, bargain, negotiate, whatever we can do to reduce our cost. So keep an eye for billing errors so that we don't have to pay for we didn't use. After these 6 general strategies, let's move on to some insurance and employer benefits that we can avail that can reduce our cost as well. The next category is insurance and employer benefits. And there are 4 points in it. And we're going to continue with the enumeration that we started in the previous category as well. So number 7 is understanding the pre-approval procedures. Number 8 is medical necessity. Number 9 is utilizing HSA or FSAs. Number 10 is understanding employer benefit programs. Let's start with the pre-approval for procedure. That can save a lot of money and avoid unexpected cost. I told you about my colonoscopy experience. It was supposed to be a preventative one. I call up the insurance company. I got the pre-offerable. They gave me the agent's number that I need to. I transfer that agent's number to my provider. Then there is a documentation that it was pre-approved. But when the bill started coming, it kind of came as diagnostic. But because I had a pre-approval process, I had a precedent set to negotiate with them. It's a different matter that it went a different direction, but because I had the pre-offerable done, I had a case to negotiate. Therefore, not only about negotiating and understanding cost upfront, but also about when you get a pre-approval process, we can uh, avoid the unexpected cost. So, and also depending on the insurance coverages, there may be tests and process that's covered and not covered, that may require approval and not approval. Again, it's a maze, correct? But the rule of thumb is for any expensive ones or even inexpensive ones, get a pre-approval pre-approval that can save a ton of money. Number 8, understanding medical necessity. As I said earlier, there are people who are in different spectrum of severity. For some, the root causes are identified easily, and for some, they have to go a longer trial and error. Right? As I talked in one of our videos, that the different causes of constipation or different causes of GI issues, lifestyle related, physiological, neurological, and there may be different tests for neurological, a different test for physiological, and that may or may not be covered. And when providers perform those tests, the insurance companies can categorize that as experimental, and then they can charge a lot more. But the trick to that is, as I said earlier, now you have got to fight like an MMA fighter and say that's medical necessity, and also request, plead, or whatever we can do to you to request to so that even our providers would use this magical words, medically necessity, and that can reduce a lot of cost as well. And number 9 about HSA or FSA. So HSA is health savings account and FSA is flexible spending account. So there is a little bit of difference in that. The similarity is both of those are pre-taxed pre-tax money that we can spend on our healthcare. And the difference is HSA is roll over from one year to another year, and FSA is it just resets every year. And if you don't use the money in FSA account, it just gets uh, the insurance company or it gets taken away. So we lose that money if you don't use it. Whereas for HSA, it rolls over one year to another. Both of them are pre-tax money. So for FSA, if you know you are going to spend on healthcare cost, it's it's useful to utilize that. And even HSA is if you're not sure whether you are going to use that for particular money that particular year, use HSA. Obviously, both of them have certain limits, upper limits to that. And if your healthcare cost is extremely higher, then utilizing HSA and FSA, we can save a lot of money because you're spending a pre-tax dollars and you're not spending the post-tax dollars on the healthcare cost. And that can save a lot of money as well. So please understand HSA and FSA in detail, and depending on your healthcare cost, known and certain and uncertain. If there is certain cost, then you can avail for FSA, but still uncertain cost, you can still use the HSA. And with the HSA, I'm also understand if you don't use it, you can also invest in money elsewhere so that it start multiplying, compounding the money if you don't have to use it. So understanding these benefits and what are the limits and how much contribution your employer is going to make and all of make that can save a ton of money and also that make you more money as well with using understanding these HSA and FSA. Number 10 is understanding and leveraging employee benefit programs. For example, one of the triggers is the stress and anxiety and depression for GI issues. And I didn't know this. My insurance program had this 5 sessions of therapy sessions for free as a mental health benefit program. So when I learned that, I able to use that around. For you also, there may be one. There may be specific GI related ones. There may be the exercise related ones, the physiotherapy, and so on. There are a lot of benefit programs, and the benefit programs are variable according to the health insurance plan. So when you can utilize those employee benefits programs, that can also reduce a lot of costs, because if you are going to pay out of pocket for therapies and it including the deductibles and so on, you would have copays. If you don't have, you have to pay separately beyond the employee benefit programs. But if you have even employee benefit programs, you can avail to those and save a lot of money, and we can overall reduce a lot of medical cost. So after this, I want to talk a bit about cost management strategies as well. So let's uh, move on to the next section, cost management. So let's talk about cost management. And there are three different items that we're going to talk about. And number 11 is negotiating medical bills. Number 12 is shop around. Number 3 is seek patient assisted programs. So about negotiating medical bills. Whenever there is a bill comes in, you can always call up and ask your health provider and say whether you do the following things. A, what you can do is you can ask for discounts. Number two, B, or what you can do is you can ask for payment plans for high medical bills. And I was surprised, as I told you earlier, these medical bills are so negotiable. And obviously, for them, if they can collect as any revenue as possible instead of getting patients not paying for it or delaying paying for it, going to collections, and they will be making more less cents on a dollar. So maybe giving them the discount will be way cheaper than actually not giving discounts. So always ask, and surprising that how much you can get away with by just simply asking. And even I didn't know we could negotiate for medical bills. So just having an idea that we can is very powerful. So please, if possible, I recommend, or I negotiated for medical bills, and many people can and should. Number 12 is about shopping around. And this is quite challenging, I must add, but it's possible to go and shop around for different, cost for different tests and procedures. And it's very surprising that how these costs are variable. For example, for colonoscopy, which I can talk about, can range from $1,000 to $3,000 to $4,000, $6,000, depending on the state. It's baffling to me. For me, for example, it costs around $3,700. There are some places places that it can cost us $1,700, and obviously you can just shop around. And if those are in network, you can obviously avail to the cost. And more like the most likely scenario is that we can't give you that number. We can give you a quote or things like that. You're going to hear a lot of those. But again, be proactive, shop around. It can save a ton of money as well. And number 13 is seek patient assistance program. So there may be programs. Again, I'm not eligible for that, but I don't know much about these things. But upon researching, what I figured out is there are patient assistance programs. Hospitals may have them, nonprofits may have them, state may have them, federal may have them, that can probably reduce cost and so on. So always ask for those. So these are around the patient, cost management. And next three categories we are going to talk about: special considerations for low income, advanced strategies for high income, and obviously talking about advocacy and support. Let's move on to that part. And I here's a quick disclaimer. These three next categories, I haven't got a personal experience to that, but I researched and synthesized for you, because the listeners of this are chronic GI patients, could be at different income level and may require different levels of assistance. So to make this information accessible, I researched and synthesized this information for those kind of folks. Special considerations for low income group. So point number 14 is Medicare and Medicaid for low income and seniors. Ensure that you're maximizing benefits available through these programs. And number 15 is senior discounts and programs. Seniors should always inquire about discounts or programs specifically aimed at reducing healthcare cost for the elderly. Different companies, there are different programs. I think seniors must take benefit of that to reduce the cost. And number 16 is community health programs. Use local health programs or clinics that offer services based on income, and it could be beneficial for low income individuals. So if you are low income category and problems like this, and if you're a senior, make sure you take a benefit of Medicare and Medicaid. And you can always go for, if you're a senior citizen, always go for special discounts. And obviously, there may be community health programs that you can make available too. And if you do that, it can reduce a lot of cost for you. Let's move on to the special considerations for people with high income individuals. And I just have two more points on this. One is 17 number is consider concierge medicine. So obviously, if you can afford, get for more personalized care and potentially more efficient treatment management plans that you can afford for it, maybe you can going for that will help you shorten the path of recovery. And obviously, we can afford to. Number 18 is invest in comprehensive insurance plans. It may have high premium, but the number of tests, the number of procedures, the treatment plans, you account for that versus the amount you're paying for insurance plan may be overall saving. That may be really, really helpful for high income groups. Not that you're trying to save money, but again, every money that you save is beneficial that you can spend on something else or you can invest on something else for long term your financial health. Because financial health is also absolutely important, not only for low income group, but also high income group, because I consider financial health is one of the important metrics for great life. Now, let's move on to the final category of it. The final category of is which is one of, I believe, underutilized, but it can be very powerful, which is number 19, leveraging support networks. I just been telling repeatedly again and again that when we become the scientists of our own body, we start knowing a lot about our health systems, more than a doctor can, because we live our body 24/7. And there are thousands and millions of people like this. You can share your knowledge about those symptoms, knowledge about what works, what doesn't work, what helps, what hurts, where can affordable care and affordable care, how to ask questions, negotiate questions. I think it's so beautiful that there are people out there who are willing to help. For example, I have found those support groups in Reddit. You ask questions, people respond. I have found in Facebook groups. I think I've found influencers or advocates in Instagram. Again, when we bit of remove the taboo about talking about the GI issues, it's so surprising that people around us have the same problem. For example, my friends, close friends have those kind of problems, and we exchange ideas about that. So it's absolutely important to leverage the support networks around you, around us. So that can help us feel not alone. Why me? And it's about, okay, it's not only about me, there are other people as well. And it's inspiring as well. There are people who are taking charge of their health and getting better and spending less money. And we can get a lot of informative, useful, practical ideas from the support networks. So please leverage them. That can save a lot of money as well. And number 20 is being proactive in healthcare discussions. Obviously, one of the things as patients do is when we go to doctors, they are of course trained in that particular part, and we become the passenger or the on that particular bus of our health bus. But we should be the driver, and everything else is the passengers or navigators and all. So when we discuss proactive with our healthcare, proactive with our providers, insurance programs, and so on, it actually helps to narrow down the treatment options, the trial and errors, and so on. So 20 is be extremely proactive in the healthcare discussions with the providers, symptoms and all. Be shameless about it. Be assertive about it. Be a fighter about it. I think that will help save a lot of money. When I started listing earlier, I told you that I have a 21st suggestion as well to spend less. And what I'm going to say is going to sound so obvious, is that don't be sick in the first place. I know it's difficult to hear that when we have pain, when we are sick, but again, it's the best money saved is the best money not spent. And best money not spent is when we don't get sick. And obviously, we can take charge of it, regardless wherever we are at. For example, I categorize into 4 different stages of the health recovery journey. Number one stage is I call being a fighter. We have pain and we have to fight the pain. We have to get the relief the pain. Number second is being a survivor. After we have gotten away from fighting, gotten better from the pain, we have to prevent that pain. So we got to prevent the pain, do as anything possible to prevent from relapsing, from getting that symptoms again, and understanding that. From from fighter to now, I'm thinking about restoring our health. Restoring health meaning the vital signals, uh, the symptoms do not come for a long period of time, and we're starting to restore our cardio, our starting to restore our bowel movements, the digestive functions, the gut microbiome, gut health, and so on. So as a restorer, we need to be we need to restore so that it builds a foundation for the next stage, which is being an achiever. The achiever meaning high, living a high performing life. So we do not get reduced to our worrying about symptoms, worrying about cost, and when it does that, we get so consumed by it, we can't do anything else. Very productive life. So we can reach to a high performing life. Today, I have been I've been a fighter, I've been a survivor, I've been a restorer, and I have now, I believe that wanting to live a high performing life, achieving life, hence creating these podcasts, this content to help other GI patients and starting God's Fair to build an ecosystem for GI patients so that we can provide more affordable, accessible, and actionable GI care and help in care navigation. So the 21st is don't be sick. When we are not sick, we don't have to spend. And we don't have to spend, we can save a lot of money. I think that's the best way to do it. I know I empathize with all people who are at the different stages of it. And I think when you take a charge of your health, when we take a charge of health, I think getting better is possible, 100% possible. So after this, we have come to the end of the chapter, and I really hope it has been useful to you. Very less people talk about financial health, focus on more physical health aspect of it. But I think I also want to make sure that financial health is strong, and hence listed out the 20 different ways to spend less money on healthcare. Please make use of them. And obviously, if any questions, please write a comment, and I'm happy to engage.